Hi, I'm Dr. Katherine Harrell, and I am a faculty member here at the TCU and UNT HSC School of Medicine. I'm also a practicing dermatologist here in Fort Worth, and I am ready to take on the internet. What do the early stages of skin cancer look like? The internet did a pretty good job on this one with the photos, which were pretty consistent with early stages of skin cancer. But obviously, if you have a particular lesion of concern, you do want to have it evaluated rather than rely on the photos on the internet. There are several different types of skin cancer, the most common ones being basal and squamous cell carcinoma and melanoma. Each of these different types of skin cancers can have a very different appearance, particularly in the early stages. However, generally, we tell patients to be aware of new or changing lesions, or lesions that are tender, scaly, or bleed easily, which could be causes for concern. What does skin cancer look like? The internet did a fairly good job of producing good quality photos of skin cancers. However, skin cancers can really look very different in different people. So anything that, again, is growing or changing should prompt evaluation by a dermatologist. Basal cell carcinoma is by far the most common cancer known to man. About 1 in 4 to 5 people will develop basal cell carcinoma in their lifetime. Basal cells usually present on sun-exposed areas of the skin as a peak bump that is very slow growing, often has a pearly or almost opalescent quality. They tend to bleed easily and can sometimes ulcerate. Patients often mistake them for a persistent pimple. Squamous cell carcinomas are the second most common type of skin cancer, and these tend to be a little bit more rapidly growing than basal cells. They tend to present as a tender red nodule that sometimes has almost a wart-like appearance. Melanoma is by far the deadliest form of skin cancer and the most concerning. Melanoma is developed from the melanocyte, which is the pigment-producing cell in the skin. This cell also makes up your moles, or the nevi on your skin. So we like to use the guide, ABCDEs of melanoma, to help patients to do a self-exam and look for concerning signs for melanoma. A stands for asymmetry. Melanoma tends to be asymmetrical in appearance. B stands for border. We like our moles to have very regular borders. Irregular borders can be cause for concern. C stands for color. Melanoma often will have several different colors within the same lesion that range from brown to black to pink. D stands for diameter. We tell patients that when their mole expands beyond the size of a pencil eraser, that maybe that is cause for concern. However, a lot of benign moles can be larger than that. And E is the most important one. It stands for evolution. So anything that is growing or changing should prompt evaluation by a dermatologist. And it's really important to do a self-exam as well. I recommend that patients use the ABCDEs of melanoma to do a self-exam at least once a month. Does skin cancer kill you? The internet did produce a yes or no answer. However, I do feel like sometimes the internet can be a little bit alarming. Yes, skin cancer can kill you, and yes, it does answer that question. However, when these things are caught very early, it is very curable. Melanoma is the deadliest form of skin cancer, and 1 American dies about every hour from melanoma. Fortunately, when caught very early, these cancers are very curable. Harmful UV rays from the sun and tanning beds play a very large role in the development of skin cancer. That's why we tell patients it's critical to protect yourself from the sun. When you do see your physician, make sure to point out any new or changing lesions on your skin. And for prevention of skin cancer, the biggest thing you can do for yourself is protect yourself from the sun. This involves staying out of the sun as best you can, avoid peak daylight hours, wear sun protective clothing like long sleeve shirts and hats, and using a broad spectrum sunscreen daily that's at least SPF 30. And be mindful that you have to reapply sunscreen every 2 hours. You can also be doing regular self-exams, and I recommend that my patients do this at least monthly to be mindful of their moles and to be able to detect skin cancer early.